The symptoms I was suffering was when walking or standing, my left side, I would get pain from my buttock area down to my feet, and it would go numb, right? And sitting down would relieve the pain. And so I would have to sit down for a few minutes and it would go away, but then sometimes it would, in just a few more minutes, I'm standing again, it would come back.
We have a name for that. We call that spinal claudication. You have the spinal claudication, you have a spinal stenosis, and your pain could be explained easily with what the finding that we had inside of your spine. So 1 to 10, how bad was the pain?
I would say it was about an 8 on the scale of 10.
And
the numbness mainly was what bothered me the most, though.
Yeah. And this is what we did. We did a 2-level fusion here. And now we see that bone is beautifully growing here in the back, solid, and as well in the front here, bone is growing there. Do you remember the surgery?
I remember the date I had it.
No, when did the pain go away?
The pain went away very quickly, with almost the numbness, and the pain was pretty much cured instantly, really. I could just even a day or two after the surgery, when I would walk or something, I didn't experience any of those symptoms.
Okay.
Just the back pain from the surgery.
How long did that take you to be back where you wanted to be for daily activities and so on?
Well, let me put it this way. The strong pain medication, I took myself off it in 10 days.
In 10 days, you were off narcotic.
I was off narcotic.
That's amazing, actually.
And just taking acetaminophen and some of the other muscle relaxer, you gave me that, and I didn't even finish those.
Yeah. Now, for people who are familiar with spinal fusion, they know how spectacular it is to be off narcotic in 10 days, and waking up, the pain is gone, the claudication or the stenosis is gone. With the surgery, that's 53 minutes for 2-level.
Yeah.
How are you now?
I'm doing really good, thank you. And I still have a little bit of nerve issues with the bottom of my feet, but that's slowly recovering.
Okay.
And but as far as mobility, I can do pretty much anything I did before.
Okay.
And I've started swinging a golf club.
Excellent. So you're back to
and I
your
no
hobby.
issues.
Yeah, good. May I ask how old you are?
I'm 74 years old.
74
years old.
Young. Years
I
young.
feel young.
Yeah.
I've just recently started swinging the golf club.
Yeah.
I would have done it sooner, but I had torn my bicep, and so that prevented that.
So the biceps was holding
the bicep
you back.
was holding me back.
Yeah. You're happy you got the surgery done.
And that's when people ask me how it's going, and I say I'm glad I got it done. It solved the issue.
Yeah, so you feel that the problem you had is solved, and it took us only 53 minutes to solve that problem.
I wasn't aware of that. I don't think you had told me that before, but that's not very, you work pretty fast.
No, it is the kind of surgery we do is fast. Flying is always faster than driving.
Yeah.
So it's a different kind of surgery that solved the problem fast, and I think that's important for people to know that longer surgeries are inherently more risky than shorter surgery. So if there's a method to do the surgery faster, complication rate is much lower.
I understand.
And that's the benefit you're getting from the surgery.
Well, anyway, thank you. Good work.
Thank you and thank you for the interview.
You bet.